I think it's really exciting to see the conference that Abe and his team have put together. I think the idea of a week on innovation and imagination is about the best week that I could imagine in my life. And it's my privilege today to introduce our three panelists for this moderated luncheon discussion. I'd like to start with Lee Huntsman. He is a President Emeritus. Normally in academics we talk about Professor Emeritus, so I think President Emeritus is a new title, probably, from the University of Washington. And he is a leading bioengineer who spearheaded Seattle to become an international bioscience hub. In addition to his work at the University of Washington, he serves on the board of directors of 5 healthcare startups, including one here in Missoula, Montana, which is upstream research. He also served for 7 years as an executive director of the Life Sciences Discovery Fund Authority, which is a private-public partnership focused on innovative research in the state of Washington to promote the life sciences, enhance economic vitality, and improve health and health care. And I think that's really important from my perspective because this idea of a public-private partnership to spark innovation to solve human problems, I think is a really important part of our discussion this afternoon. Immediately to his left is Kwang Kim, Kwang. And it's really interesting to see that he is a global strategy and competitiveness advisor to Fortune 500 companies around the globe. He also consults with cabinet ministers in Africa, Asia, Eastern Europe, Latin America, and the Caribbean. In fact, he told me that he's leaving tomorrow to go to Jamaica from this conference. Through his public service and management consulting, again, that intersection that we're talking about, he has advised strategy and competitiveness challenges at the business level, the industry level, and at the policy level for nations. I'm really looking forward to hearing about some of your work, and I just would like to read one quote about him that I think is quite interesting. Let me find it here. Kwang Kim is the most global citizen that I know. If there's a question at the heart of his life, it is this: what should the world be like? Is there a way we ought to live in the world, one that has implications for the way that development is done, whether that's in the Middle East, Latin America, Africa, or in the cities and societies of the Northern Hemisphere, where there is still such crying need? This is a quote from a book, Visions of Vocation, Common Grace by the Common Good by Steve Garber in 2014, and I'd really like to read that. Our third panelist is Allison Plosko, who works at a very innovative nonprofit called Village Capital. Village Capital helps early startup entrepreneurs through peer-to-peer methods of building businesses. So when we talk about peer-to-peer, it's a very different model than asking venture capitalists to evaluate whether somebody has a great idea. This is asking other entrepreneurs if they believe other business ideas are fundable. And this major innovation in the way we talk about financing startups has received a prize for innovation from the Management Innovation Exchange. Their company has been written about in Forbes, probably one of the most conservative business publications, as pioneering the way we ought to think about the way startups are done. And Allison is the vertical marketing manager for their healthcare unit. So I'm really looking forward to your insights that you have about this. She says that it's really important to realize that people do good by providing incentives to other people to solve problems, and I think that's a very important perspective. The last thing I forgot to mention about Lee that I thought was quite remarkable is that he holds 2 patents, and I think the intellectual property process of our startup environment is critical. And if I can quickly find the title of his patents, I wanted to read them to you, but I don't know that I'm going to be able to find them quickly. So the idea of having bioengineering patents is an important part of our startup community. Our moderated discussion is going to have essentially 3 buckets of questioning where each of them will give some comments about those questions and interact as a team. And we'll also have some time if any of you have questions for the panelists. So know that there will be an opportunity for that near the end of our session. But to start with, what I'd like to ask the panelists are, what do you see as the major shifts that are underway in both the American as well as the global healthcare system? And what are the forces driving those shifts? Dr. Huntsman, could you start, please?
Thank you. It's a delight to be here. If any of you heard my talk last night, I mentioned that one of the key personal qualities for working in this area of innovation is humility. And I'd like to point out that this fancy title I have, Emeritus, is actually a humility reminder. It's a Latin construct, of course. It's two parts, E. E means you're out. And meritus means you deserve it. So I would like to welcome you all to a humble approach to the challenge of health and global health. And one of the reasons I emphasize humility is I think that one of the very first things we all should do as we consider this kind of work is to try to actually articulate our assumptions and evaluate those assumptions. One of the things I found fascinating this morning was the reference to how much progress has been made in global health. And most of us, I would argue, are probably out of touch with what the dominant health conditions are in various regions of the world. Things have changed substantially. What the needs are, and how to address those needs from what is most often a Western perspective, but needs to be moderated substantially. As a case study in that, I would point out, I was at a conference somewhat like this a number of years ago, 15 years ago, in Kyoto, and we were talking about the potential of technology to help global health. And in a breakout session, the moderator asked us, first of all, he said, how many of you think that the lack of a market is a fact, and indeed a limiting fact, for the future of technology in developing nations? Nearly every hand went up and said that this is a reality. There's simply not a market. There's not market incentives. This is going to be long and slow. He said, I'd like to introduce you to three of our participants, all of whom are actively deploying technology in Africa today. And that was 15 years ago. And what they immediately confronted us with is, you need to know more. You need to understand the circumstance. You need to match your innovations to those circumstances, and be very careful about your assumptions. I think that the big factors driving change are, in fact, those on-the-ground assumptions, both the health assumptions and the economic assumptions, are shifting. And simultaneously, the developed world healthcare is changing in a direction to bring the same concern for cost and efficiency to the developed nations that has always been a big concern in the developing nations. And so I call that a foreshortening of our various parts of the world with respect to health and health innovations. I think those are big factors that can drive us all to really thoughtful and very constructive innovations.
Good afternoon. Delighted to be at this conference, and thanks the Mansfield Center, Dr. Abraham Kim and Jakki for having me here. Just want to pick up on what Professor Lee has mentioned about some of the driving trends towards the emerging markets and countries. I think a lot of the growth in the coming years, both in the pharmaceuticals and medical devices industry. A lot of that will be driven in the developing country. And what I'd like to notice quickly is that is the new players that are coming into this space, and it's what's exciting about the new players are the intersection between business, those who care about businesses, as well as social impact, and that's manifested in different groups. And Allison can talk a lot more about impact investment and social entrepreneurship, which is one angle that's coming in. The other really interesting movement as an energy is the whole concept of corporate share value. That's really energizing a lot of the business students, MBA programs, just around the world. MBA programs just focus a lot more on shareholder value. How do we maximize shareholder value? But let's face it, nobody wants to leave for shareholder value. That's not really energizing. Can you imagine the purpose of a life is shareholder value? So the whole area of share value has opened a new area where the intersection of where corporations can have a sweet spot between business impact and social impact. And the health sector has been a very natural fit that's driving the shareholder movement. A lot of the pharmaceutical companies and the medical device companies are really jumping into how do you really improve products and markets? How do you make your products R&D markets how do you differently in the new opportunities that are emerging in the emerging markets? How do you improve the efficiency in the value chain? How do you drive down cost in a way that makes it marketable to your end consumers? And finally, how do you really engage into a public policy dialogue where companies, stakeholders, and the government can engage to improve the overall environment for healthcare and medical devices? With that, I wanted to pass to Allison to talk more about her space.
Great. Good afternoon, everyone. Thank you, Dr. Kim and Dr. Mohr. I'm excited to be here and talk more about innovation in healthcare. So picking up where Kwang left off, so you've seen a big shift in philanthropy on a macro level. And so people are starting to reevaluate the way that traditional philanthropy dollars are being deployed. And so one of the newer areas, and I think you're seeing it more and more, and it will pick up steam over the next couple of years, is this idea of impact investing. So the idea that you can do good, but also make a profit, and that it's not bad to make a profit, and that in fact you can actually go farther by doing so than you could by the traditional nonprofit model. And so one example that Kwang mentioned with pharmaceuticals and therapeutics, these have very long paths to market. It takes a lot of capital to get there. And so traditionally, foundations who were maybe interested in Duchenne's would fund very early basic life science research. And what was happening was that it was getting bottlenecked. And you haven't really seen that basic life science research translate and get commercialized and do good. And so I was actually at a conference yesterday, and one of the foundation presidents is now shifting their model to reflect more of this idea of impact investing. And I think you're going to see that more and more because people are realizing that there needs to be a sustainability aspect to it and that you can get better results. I think on a bit of a micro and to shift back to the US a bit, you've seen a lot of policy changes that have forced healthcare organizations to reevaluate the way that they do business. And so you're seeing a shift. Somebody mentioned earlier the reimbursement shift from fee-for-service to value-based care. Just recently, April 1st, you saw bundled payments go into action for hip and knee replacement. And this is changing the way that healthcare organizations are thinking about healthcare, and it's creating a more, I would argue, holistic approach. And so we focus, the companies that we work with, we are impact driven, and so we look at those that are tackling issues of improving access, the social determinants of health, and ways that technologies can solve them. And the revenue streams that these entrepreneurs are banking on are really a result of the policy change. 10 years ago, many of these companies would never have existed just because they wouldn't have been able to make money.
Lee, it looks like you have a comment on one of the prior speakers' comments.
Well, I want to emphasize what Allison is saying. I think the realities of what you might call the health innovation marketplace or marketplaces are shifting, and they're now starting to shift with increasing velocity. And there's huge implications of what goes on in the US and Europe for what is possible in the rest of the world. Just imagine that you are a major manufacturer of imaging equipment. Okay, you're a Philips or a Siemens or a GE, and you make MRIs, and you've made a very good living by advancing the technology and selling the next shiny imaging device because it gives a little bit better pictures. And you've done that so well because in the highly distorted American marketplace, every clinic of any size has created an imaging wing, and they've done that because imaging is a procedure that is reimbursed under a fee-for-service structure, and if you run your imaging operation well, you can generate a profit from and you can cross-subsidize other things. Well, in this new world, there's going to be no such thing as a profit center. There's only going to be cost centers. The healthcare provider is not going to get more or less money depending on how much imaging they do. They're going to think very differently about imaging. Therefore, they're going to think differently about you, the manufacturer of imaging equipment. You need a wholesale reinvention of your strategy. You need to think about who your customers really are going to be, what their concerns are going to be. It's going to be very much about value, and how you're going to profitably but effectively address their needs. When you do that, I would argue you're going to be much closer to thinking correctly about what the needs of healthcare providers are in India or China or Indonesia or even Africa. This is what I have referred to as the foreshortening. You need a wholesale new strategy, and it's being driven very much by your primary market, America, which is now essentially turning upside down in terms of financial incentives, but it's going to be hugely influential for how you think about all these other markets as well.
Okay, well, it's interesting to hear about some of these new terms, maybe new to other people, about things such as the shared value approach to business, I think is a really important one, and this idea of impact investing. So now that we've talked about some of these big shifts, I'd like to start with you, Kwang, please, on this question. If you could each think about some of the emerging innovations that you're having some experience with, and I think these could be innovations both in technologies, which would be product innovations, innovations in delivery of healthcare, and even business model innovations that Lee was just alluding to. Let's take it to the next level of specificity and hear about some specific innovations that you see as particularly promising in light of these shifts.
Sure. One of the examples that I think can help to illustrate, and by no means it's comprehensive, but just give a bit of a flavor in terms of what's happening on the business model and the delivery side, is with a client that worked recently in Haiti, and what they're trying to do is a big problem in Haiti is water. Anybody who's been in Haiti know that water is one of the critical issues. in that country, and access. And a lot of the services are around Port-au-Prince. And right now, commercial water is being distributed by these very old trucks that it takes forever to get to 1.8, 1.2, handed into a container, and then put into little sachets and sold. Very, very unsanitary, expensive, and inefficient in the process. So what this company has done is that they have decentralized their production of water purification facilities in remote areas of Haiti. And then they're providing essentially last mile distribution from the purification centers to these small mom and pop shops across the country. And it's a simple concept, and why haven't anybody thought about this before? But it's extremely difficult to implement. First of all, it's getting permits and all that to set up the water purification centers, setting it, having people to trust it, and the whole setup, the relationship between the company and the distributors, that's a very tricky one, especially if you want to scale. What type of system, procedures, and tools you need to effectively actually come up with a system that scales. It's actually so simple, but it's so difficult that if this company succeeds, a lot of the multinationals are interested in replicating that model in other fragile countries across the world. And again, simple concept, but it's not really being done. So it's commercially sustainable. It's the water being sold cheaper and cleaner and more efficiently than all the alternative that is out there. And people are, I've seen with my own eyes, people are excited about the product. It has increased water access already in various points in Haiti. But again, the challenge right now is how to scale, ensure that they have the systems in place. This might be of interest, Jakki. A lot of the information systems really adequate, appropriate for the BOP markets, bottom of the pyramid. They're developing whole sets of tools that they're making available open space, open source, so that other companies can actually apply for the bottom of the pyramid, the poor market. So I think that's a very exciting to see models like that that's providing a solution to access to water in a sustainable basis.
Great example. Allison?
Sure. So I think when we think of global health, one of the things you have to think about is infrastructure. And so it is one thing to get the necessary pharmaceuticals to a region, but there's often a last mile problem. And what that means is that getting, whether it be energy, water, medicine, that final mile is often the most difficult. And so we've worked with a company before that is looking to solve this problem through basic text messaging. I think sometimes it's taken for granted that everyone has internet access, but that's not the case, especially for last mile. And I think one of the other really interesting areas that's going to come up with technology is this intersection of medical devices and big data. And so another company that we worked with was a low-cost cervical cancer screening diagnostic. And it was very easy to read output, red, green, or yellow light, and it used a biophotonic sensor to assess the cervical cancer wall, but you didn't need a doctor. And so there's really high potential there because there's a doctor shortage, and especially in rural communities where you don't have physician access, this could be very instrumental. But what's really interesting about this is that is one component. The much bigger side of this is the data that can be generated from knowing the maps that were mentioned earlier this morning, what are the areas or pockets of high cervical cancer rates? You would now be able to do this on a very micro level. This is still long term, but who would pay for that access? Pharmaceutical companies, because they can then deploy the drugs to these various regions. And so that is an interesting concept that I'm seeing more and more, is where can you generate data that hasn't been generated before, and oftentimes this is in global health and in emerging markets, and the customers are usually pharmaceutical companies that are looking for that particular information. I think the other really interesting area is in elderly care, and this idea of remote patient monitoring. And so sensors are a critical component of this. We're not quite there yet because you have this just deluge of data and nobody really knows what to do with it. Physicians are already overworked, and so to put that on their plate is right now not the direction that people are wanting to go. And so, but there's huge potential to use sensors for rural communities, for elderly patients, to keep them in their home longer and reduce the cost associated with that care.
My experience is that the most innovative and successful entrepreneurship is happening almost on a case-by-case basis, where the innovators have taken the trouble to really understand the need in the local conditions, and sometimes, though, it is really surprising. For example, there's a European company which is very interested in investing for impact and making a difference, that figured out how they could create a new technology for cooking to reduce the use of wood, the exposure to smoke, and all the ancillary consequences of that in the areas of Africa that use that kind of cooking. They could create a really innovative new stove, and they could give it away, because they could claim the climate improvement credits and sell them in Europe. Well, that's a business model I would never have thought of, right? So there's both a need to understand the local nature, but also the macroscopic opportunities. And this notion of impact investing, it's very real, but it's also not nearly as simple as it seems. There are a lot of investors who will tell you they're interested in impact investment, but of course that should come after their 10x return. This is all very complicated, and it takes a great deal of energy and thought, and there are many ways to slip and fail. It reminds me, there's a lesson from entrepreneurship in this country, which is it's really hard. It's really risky. And the risks are not always the ones that you expected. My experience, frankly, in the areas of medical technology are that the geeks in the back room solve the technical challenges with not automatically, but with fairly high regularity. The MBAs in the front room, who are making market assessments, fail much more often than the technology people do. That's not because they're less intelligent. It's because, in some ways, understanding the market is hard, even harder than the technology challenges. Not always, but often. And if that's true in this country, you can imagine what it is like in this very diverse global environment that we're talking about. I mean, what is needed in a number of these countries? I have a good friend who's a leading physician in Seattle. He spends a month every year at a hospital in Kenya trying to help them improve and do a good job. And the problems he describes has nothing to do with water. It has to do with how to implement a reliable, cost-effective IT system in a Kenyan hospital. They're struggling with that, okay? And so that's shades of our kinds of problems. So the point is that the needs are very localized and need careful, patient thought. And part of the essential ingredient here, I think, back to one of Allison's points, we need investors, be they commercial investors or government investors, who are willing to look at that opportunity and be both supportive and patient. This is hard work, but there are tremendous benefits to be reaped here.
Okay, so we've added now this notion of, I think, two of the three of you mentioned the problem with the last mile. All of you have mentioned this idea of the base of the pyramid, which is innovation that's coming from solving poverty and health concerns among impoverished people. And then Lee has mentioned this idea of the riskiness of the market and the technical assessment, as well as the need for investors. So I'd like to have you comment, starting with Allyson now, please. The challenges or barriers in allowing these innovations to achieve their potential. We've talked about some of those challenges. You mentioned the scalability for something that is so simple but is so difficult. So if we can talk a little bit about the challenges and what are some of the solutions to those challenges. I think we've also heard about the need to incentivize these various stakeholders. So Allyson, could you start with that?
Yes. So I think scalability is absolutely a problem, because going back to Dr. Huntsman's point, you do have to have a very localized solution, but a lot of times that doesn't always scale. And so how do you address that? And I think some companies are able to do it better than others, maybe because they're more IT driven or just given their subsector, but I don't think there's an answer for that as a whole, unfortunately. I think part of one of the barriers as far as just this transition across borders and implementing technology in emerging markets, you have to be very careful about not making assumptions about cultural norms and practices. And I mean, just very basic things are different between countries. And so part of what I know a lot of investors look for when you're a US entrepreneur who's looking to sell into the India marketplace is, do you have individuals on the ground who understand local practices, who have the networks in place? And if you don't, that's just not a sound investment decision, and most will take a pass. And it's unfortunate because that means that the entrepreneur really has to devote a fair amount of time to understanding the emerging market. But I'm coming from a place where I think that those who understand the problem, who have faced that problem, are much better equipped to design a solution than if you're looking at it, 10,000 miles away. And so, but again, going back to the U.S. entrepreneur context, I think having individuals on the ground is one way to navigate the cultural differences that often plague that market entry.
I'll be quick. I think we could talk for a long time about the challenges, but let me just point out two, which is one, which is the gap between of talent and funding, investors. I think it's a great trend that there's a lot of excitement about emerging markets and so forth, but if you come down to specifics, even though we saw earlier the huge gap between medical talent and the needs out there, it's also true that it's also an opportunity when you see that we have a huge underserved market out there, and yet investors, I don't think that the level of investment or investors' interest is out there, so in a way that matches the opportunity, nor the talent of people the best and the brightest, who could be seizing this opportunity into enough of a critical mass to take advantage of this opportunity. One conversation that I had recently with the CEO of the company in Haiti, and it was an exciting business model. If he was doing this anywhere else, you have no issues getting funding. And he has pretty good funding backup, but he was just so surprised with given the quality of the business model, the opportunity. He said, quote, "Nobody cares about Haiti." And I think that's the reality that a lot of these good businesses and companies are facing with at the end of the day when the rubber meets the road. There is lack of real interest in those places, even though there are tremendous opportunities. The risk appetite and profile is not out there on the investment side, nor the even in the talent side. I was just amazed to see this team of people in Haiti. If you've been there, everything's simple errands like getting something from the grocery store. It's risky. So something goes wrong every day. And I felt that whenever I go there, that I joined a team from the movie The Martian, where they have to every day struggle with something that goes wrong and adapt and survive. And that's the type of of people and skills and attitude that I think it's really needed in places like Haiti. Again, but those type of skill sets and interests is sort of missing. So I think that gap between funding and talent set to seize the opportunity. I'm talking about extreme cases here, but that's I think what's missing.
One of the things that strikes me is that in our need for caution about our assumptions about these countries and societies and their needs, we also need to have caution about what we assume their local capabilities are. And as Allison's pointing out, you need boots, okay? But the fact of the matter is, in many parts of the world, if you look carefully, you will find, in fact, deep expertise. Bangladesh is a country with enormous medical health issues, a global health crucible, if you will. It's also the home to one of the best, most sophisticated global health research institutes in the world. They publish in the very best journals. They carry out full-blown clinical trials. So it's an example. You really need to look deeply to who those partners might be. They can help you enormously. You also need to be aware that in almost every country, they are, whatever their state of development is, they are fully aware of Western standards. They will often say, don't talk to me until your product or your service is approved by the FDA in the US. They don't want second class or experimental health services and health products. They're very aware and informed, and oftentimes can in fact be your partners as you move a technology, a service, or business model from an idea into fruition. And it's important to really look for that reservoir of expertise in each of those markets.
Well, now we're getting some of these paradoxes out that we need local solutions that scale. It's a paradox. We need things that are simple, yet they're extremely difficult to do well. This idea of the paradox between the deep expertise and the funding. And so I think as we continue on this conversation, another paradox perhaps is the health-wealth gap that I'd like to surface a little bit. And I'm wondering, I'd like to start with Allyson again about this, because I think that's something that you are particularly motivated to solve through your innovative business model that Village Capital has. And as you talk about that health-wealth gap, I'm just going to prompt the other two panelists here. Kwang, this notion of what ought we to be doing? The ought part of it, I think, is really interesting, and these norms for development. Because what we're hearing Lee say is it's not a relative standard, that there are some absolutes, and I think that's also an interesting paradoxical notion. So, Allison, could you start, please?
Yes, so a lot of our investments and companies that we work with are around this issue of bridging the health-wealth gap. And so, as many of you might know, your zip code determines more about your healthcare outcome than the doctor that you see. And what's really interesting is there was an article that came out in JAMA yesterday that showed almost a dollar for dollar correlate between your income and longevity. And so they used the example of, you have someone making $5 million living in house A. You have someone making $6 million in house B right next door. That person making $6 million more is going to live more than the person making $5 million more, just likelihood. And it's really interesting how economics comes into play when you're looking at healthcare. And so what I'm particularly motivated in finding are solutions to not just issues of access, but issues of health education, financial literacy. With the ACA, you had a lot of people who were getting health insurance for the first time, but had no idea how to use it. And so their default gauge for judging quality was price. And so what happened was that you wound up with people who had gone with the lowest monthly premium but had this very high deductible and wound up getting hit with medical bills that they couldn't afford. And so there are ways that you can improve that just through education. And so oftentimes you take for granted these very basic ideas of understanding health insurance. And if you're just trying to survive on a day-to-day basis, you might not think about. And so I'm a firm believer that technology can help solve those issues of education and all of these other social determinants of health that directly impact your overall health outcome.
So the question about what development ought to be, especially in the context of health, I think first let me step back and say what development is, and then talk about what ought to be. I think one way to summarize what development is through this, what I classify, walk through the 7 schools of thought of development. One is the micro school, which pretty much says stabilize, democratize, privatize, and liberalize, and somehow democracy will happen. That's the famous Washington consensus. Right, simple. Then there is the microeconomic school. The microeconomic school is best exemplified with a quote, it's not nations that compete, but firms, industries, firms and industries. So it's much more of a grassroots base. It doesn't, even if you advise the central bank of Zambia to reform and adjust the interest rates, if there's nothing to produce, there's so much you can do through macro policies. So that's Michael Porter, that quote from Harvard Business School professor, on the focus on firms and industries. That's the micro school. And then there is the human school, which is exemplified by this quote. The only investment with possibilities of infinite returns is investment in children. That's beautiful. Who could contradict that statement? That's by Gary Becker from Chicago. So that's the human school. I think health can be also classified within the human school because you're developing human capital in that sense. I'll go back to health in a minute. And the other school is a natural resource school, which basically it's a de facto way a lot of countries use to develop, which is using natural resources such as commodities, extractive oil, gold, and very basic agricultural products to compete. And there's a lot of studies that have shown the danger of depending on commodities, but it's a de facto strategy that a lot of countries actually use to develop. That's a natural resource school. And then you have the knowledge school. Knowledge school is all about filling knowledge gaps. So if there is any gap in the country, by filling up this knowledge gap, you can develop. And the person who represents this is Paul Romer from Berkeley. And Korea, my own country, has many years ago focused on knowledge-based economy. A lot of countries are really focused in IT, knowledge-based systems. That's really the knowledge school. It's very influential. And then you have the institutional school, which is about rules, norms, and this. Have you heard this quote when people say, "If only we got rid of corruption, development will happen"? And that's really fits into the school where we have the anti-corruption drives and so forth, better fiscal management. So that's the institutional school. And finally, there is the cultural school. We talked a lot about the culture earlier today, and that's a bit controversial in the development field, but it's about norms and attitudes. Larry Harrison, now at Tufts, had a conference about 10 years ago on the role of culture and development, and brought all the major players, Porter, Sachs, Fukuyama, all talking about social capital and norms. So all these schools are important, and I quickly summarize this whole field, and they have something important to say, but the problem is they're not talking to each other. And there is one of the biggest challenges and opportunity in development is this lack of integrative thinking, where a lot of the innovation really can happen. It's a tremendous missed opportunities. We're talking earlier that this happens not only between different schools of thought, but also between different stakeholders. International development, there's so many ideas that are popping up there. There's not talking to local US development. I think there's a big gap between knowledge sharing between what's happening internationally and what's happening locally. So there's a lot of this, there could be many different factors, silo mentality in the development field that's preventing that. For example, in public health, a lot of innovation that's happening in public health, like behavior, it's not about cost benefits, but why people stop behaving a certain way. It's not by saying you're going to die if you don't behave in this way. That doesn't quite work. So it's not cost-benefit analysis. It's really about role model behavior. What has really well in public health is the role model behavior. That could be a tremendous opportunity for in the social enterprise space. But how you promote better social entrepreneurs is not only just cost-benefit, but through role model behavior. So there are tons of opportunities to learn from each other, but that's not really happening.
And Lee, what are your thoughts about this health-wealth gap and some of the integrated thinking that Kwang has mentioned?
Well, the need for integrated thinking makes a great deal of sense to me. But I am naive enough about this that I also wonder about the sequence of things. You know, I'm from Seattle, and probably our most prominent citizen is Bill Gates, right? And I have known the Gates family. His dad is a terrific guy, a leading figure in our community, a famous lawyer. I have a clear image of the time Bill Sr. Was talking about his son and literally teared up, not about his son's success with Microsoft, but his son's decision to dedicate his wealth to the benefit of others, and particularly with a focus on global health. And in conversations with Dad, I learned that Bill Jr. came to this focus on global health by his classic, rigorous Microsoft thinking. What's going on out there, and what are the key things? You know, everybody needs justice. Everybody needs institutions. You need things that work. You've got to have courts that work. You've got to have banks that work. You've got to have education. But his analysis reduced it to, unless you have a workable level of health, none of the other things can really come to fruition. Now, I don't know whether he's right, but if you start with that premise, that says that when you think about the health-wealth gap, you say it makes some sense to put a lot of focus on getting societies to that threshold of health where they can then devote significant energy to those other things. And so I still think global health, if you looked at through that lens, makes a great deal of sense with eyes wide open about all these other social, cultural, and factors and general realities that we have to face. I'm very proud of the focus on global health that has happened in my town. We consider Seattle a bit of an epicenter of global health, as you know, but we share it with all of you and everybody else. And I think there's much to be proud of and a great deal of work to be done. And I want to come back to an end on a note of optimism. I think there is a great deal of potential.
Well, and I think that is an interesting note to end on. I've just gotten the stop signal. And I had wanted to end on a note of inspiration. So I'm sorry we're not going to have time for questions from the audience, but I know that in this break, it would be great if you had additional questions to come up and ask them about individually. That would be wonderful. And I wanted to leave also with a note of inspiration. There's some new writing in the field of innovation, and it captures this idea of learning from emerging markets who have a strong perception of the need for justice and value, and it's called reverse innovation, where we think about innovation coming from the developed countries, and it's very ethnocentric oftentimes. And so I would encourage people, if you're interested in this topic, that the book called Reverse Innovation is just so inspiring. It's not about healthcare specifically, but all the issues that we've talked about that are very intertwined. So I want to thank each of our panelists for being here and your very thoughtful reflection in preparing for today's work. Let's give them all a hand.
It's great to see so many people and so many that are interested in global health, population health, and I hope everyone is enjoying the conference. It's our pleasure to sponsor this luncheon, and I look forward to engaging with you more today, certainly tomorrow as well as we gather. So, as referenced, I have a role with Providence Health and Services, and I currently serve as a COO for Population Health. I'm based here in Montana, and I really applaud you for the titling of your conference for Innovation and Imagination, because within Providence, we really are championing this innovative thought, innovative thinking, because the current ways that we're conducting ourselves are not going to sustain us into the future, and it's going to compel us to really challenge ourselves and put these different models of care in. And part of that is based upon a team approach and recognition of behavioral and mental health issues, and looking at how do we have new tools that we currently do not have at this time. So the innovation is going to be crucial for us as we move forward. So with that, I encourage you to continue to think outside the box, push us as well on the delivery side, and I look forward to engaging with you more in the next couple of days. Thank you.